So as Kelly mentioned, my name is Kim Whitley, and I chair the Delivery Systems Transformation Committee for the IHN-CCO. At every Delivery Systems Transformation Committee, which meets every 2 weeks and has met every 2 weeks since the beginning of the CCOs, we start each meeting by welcoming everybody and announcing that this committee is open to anybody in Linn, Benton, and Lincoln counties who has the ability to have a positive impact on the healthcare outcomes of our IHN-CCO members. And we say that before every meeting, and as a result have had tremendous support by our community of providers and service industry in coming together and having conversations about how to transform healthcare. When we talk about transforming healthcare, we have 8 aspects that we are required by our contract with the Oregon Health Authority to focus on. We are tasked with integrating healthcare, bringing aspects of mental health and dental health together with physical health, by creating patient-centered primary care homes, by facilitating different ways of paying providers. So historically, a lot of care has been provided from a fee-for-service perspective, and we are being challenged to pay for value. And so a lot of times in the pilots and programs that we support through this committee, they're about how do we pay differently to ensure we're getting a value product. We also work to support our community health improvement plan to facilitate the facilitation of electronic health records across our community, to support member engagement and bringing the members into their care so that they can be a part of their own care experience by meeting the culturally diverse needs of our members and ensuring that we are working to eliminate racial, ethnic, and linguistic disparities. So that's the goal and focus of the Delivery Systems Transformation Committee. One of the pilots that we approved last year is the Sexual Assault Nurse Examiner pilot. The aim of this pilot is to improve access to care for victims of person, crimes, or abuse, more than half of which are IHN-CCO members. Before implementation of the Sexual Assault Nurse Examiner program, those that have experienced sexual assault reported to a hospital emergency room where they were often had long waits before they could be seen or treated. They often had to sit outside and wait for care, or they chose to forego medical care and the evidence collection process because it's pretty difficult to go into a place where it's not secure, you're not sure, and you're in the public eye. So the goals of this pilot were to develop pathways within Samaritan Health Services to create an in-person education of ED staff and physicians and Samaritan clinics on what the SANE program was and what it could be, to reduce wait times for sexual assault patients, to mitigate additional patient trauma due to lengthy wait times, and to lead to a reduction in the future mental and physical health impacts related to care provided directly to a person in case of an assault. That we also wanted to see that the percentage of sexual assault patients that seek and receive follow-up care increase so that these patients, vulnerable patients who had just experienced this traumatic effect, were getting the care that they needed, and in addition, the follow-up care that was necessary to ensure the best outcome for their situation. So this pilot is, we've put together a video to help explain this pilot, and we're going to go ahead and start that now. And one of the people you'll see in the pilot, her name is Patty Kenyon. She's here today, and after the video has shown, we'll have her come up and talk a little bit about how that pilot's going.
Sarah's Place is a clinic that was formed by Samaritan Health to care for victims, patients of sexual violence, as well as other forms of violence.
Sarah's Place functions adopting the principle of trauma-informed care and just providing that compassionate, safe, non-judgmental care for our sexual assault patients.
Sarah's Place is more than just collecting forensic evidence. They can do follow-up exams for someone that they've met with previously. They also can just provide a medical checkup after someone's experienced sexual assault.
When we were designing Sarah's Place, we thought long and hard of the feeling that we wanted. We knew that people coming in were in a crisis mode, and we wanted something calming. If the shower can look like your shower might at home, with a curtain that is not sterile white, colored towels instead of white towels, we wanted a feeling of hope.
We're in partnership with CARDVA, Center Against Rape and Domestic Violence, and they are called automatically. So when I show up and go get the patient, CARDVA accompanies, and I introduce them and give them the option if they would like advocacy.
So it's meant to be a one-stop shop where they can meet with us, law enforcement, a nurse, a doctor if they needed to, and any other services that would be appropriate for their situation. It's pretty exciting to be connected to a center that is one of its kind in Oregon, and the first to be open in Oregon like this. It makes me really proud to be connected with a community that is supporting sexual assault survivors. I think we've really just supported the concept of Sarah's Place from the beginning because we know that this is a model to follow in the community, and we're excited that Samaritan got behind this project. And I'm proud to be involved with Sarah's Place.
You can see it in their eyes, the distraught, the loss of their self, and just wanting to restore that identity and help them feel safe. And you bring them in and you get a blanket for them and you take them into the consultation room, which has the couch rather than the stretcher, and they wrap up in that blanket and kind of curl up, and for a moment they're safe.
I love seeing somebody going out with their head held high.
So that was pretty cool. That's actually really awesome. If we think of any of our loved ones or somebody we know experiencing sexual assault and having to go sit in an emergency room, that would be added trauma. And so the ability to have a place like this that somebody can go is a tremendous asset to our community, and the CCO is extremely proud to be a part of its creation. So with that, Patty, if you want to come up and talk to us about how it's going since it went live.
Well, it's going great. Since August 1st, we've seen 130 patients. That does not include the consultations that we've provided to medical staff, urgent cares around the 3 county areas. We also have actually seen patients from outside of the 3 counties. The farthest away is from Seattle. So it's not just patients from Lynn, Benton, and Lincoln counties that can come. We see anybody that is involved in our area, our neighborhoods. So when you look at 130 patients, that doesn't sound like very much. That's actually the highest number that we had seen previously in a year. And so that's in 10 months. So our volume has gone up. When you look at each exam, the patient is usually in the emergency department, now Sarah's Place, for roughly 4 hours. I think the longest one I've been involved with was 10 hours. It takes up a bed for that long, which means that other patients have to wait that much longer. So roughly that 130 patients, we made it possible for another 260 patients to be seen in the emergency departments since our patients are no longer there. And when you consider half of those are IHN patients, that's made a big impact on that population. We are the first in the state to model a freestanding nurse-run clinic. We are over the emergency physician director oversees us, but when a patient comes to the hospital, they are seen by the triage nurse in the ER and then come directly to us. They do not have to go back to the emergency department. They usually do not have to sit and wait in the waiting room. with law enforcement at their side sometimes, which, as you can imagine, is traumatizing in itself, to just have law enforcement beside you. Most of us do not think of that as a comforting thing. We work closely with CARDVA. Letitia here from the executive director. We have an even closer relationship. They come spend a great deal of time with the patients. Safety planning can happen after we have seen and evaluated the patient. Law enforcement can come, take the statements of the patient, and it's all done in a locked, and that sounds bad, but when you think of somebody who's traumatized, to feel that they truly are safe, whoever did this to them cannot gain any kind of access to them. It also improves the care in our community, in that law enforcement does not have to come in the middle of the night to pick up evidence. They can come the next day because the evidence is stored behind 4 sets of locks. So it is, as one officer said, that's probably more secure than what the evidence is in the police station. It's not behind that many locks. Since opening, we've had a couple of patients that have required care in the emergency department, and as soon as we call, our patients are taken right back, and we can continue our care there. We also continue to respond to other hospitals. We have seen patients at the other hospitals who are too sick to be transported, or that will require admission to that hospital. So and we can go to the inpatient side of things and continue to evaluate patients. So it does not stop care. Now, in the past, we were on call 10 hours a day. Now we are available 24/7. We are staffed from 8 until 5:30. After that, there is always at least one person on call. Another great asset to our community and to our Samaritan itself, we have actually trained additional nurses from around the state, came to Samaritan. We're very impressed. We have talked with community partners outside of our area. Tomorrow I'm talking with Lane County. They would very much like to have a program like us and want to know, how can you convince the hospital to do this? And I have to say, it did not take convincing. We were championed by both Dan Kettery and Wendy Wonderwald to develop a program like this. And fortunately, Samaritan realized the value in this, because we know if we take care of patients, this population immediately in their time of crisis, their outcomes are going to be much better. Chances of having PTSD go way down. They know that they are heard and they are believed. And that's huge, to be believed once you're talking to somebody like this. Tasha, can you think of anything else to tell about the program? Tasha is the lead sane at Sarah's place. So it's a great, great facility, and we want to thank the CCO. Pardon me? Tasha says she's learning a lot. We all are. Any questions from any of you? Yes. Oh yes, we see everybody. Male, female. We are designed primarily for adults. However, one of the partnerships that we have is with the ABC House. The child abuse physicians have come over to our facility when theirs is full, and with acute exams after hours, we will see the kids there. And as you can imagine, if you are a child who has suffered abuse, to spend time in the ER with DHS, law enforcement, in this loud, not so private area. We bring them over to Sarah's place. There's toys for them to play with. It's much more calming. They don't think of it as being a terrible place, like some do the ER. So it's been great with the kids also.
Thanks. I just had a quick question. You mentioned that if people come to the ER, if that's where they report to, then they go to Sarah's house. Now, how are they? Is it by private vehicle? Are they transported? How do they
Sure.
get there?
In a various ways. Most come by private transport. They drive themselves in, a family member or a loved one brings them in. Cardva transports a tremendous number of our patients. They meet them at a public place and bring them, or they may bring them from one of the other ERs. Law enforcement will bring some in. And then we've also contracted with non-emergency medical transport, and they can bring patients to and from. We also have cab vouchers that we transport. So we are trying to get the information out that transportation does not need to be a barrier, that we will provide, have a cab come and pick you up wherever you are. And we do have those vouchers. So that's part of what we do. It sounds like 130 patients. What do you do all day? Most of what we do is education in the community, both about sexual assault, domestic violence, human trafficking, all the different forms of violence. We talk to community. We've been in the Albany, or I shouldn't say Albany, the Lynn and Benton County public schools, talking to counselors, teachers. We've been educating the medical community. We've been in all of the urgent cares, talked to the clinics, talked to registrars. So when people come, they know about us, where to send the patients, how to access care with us. We have also talked with, we've been at different health, the heart-to-heart fair, just many, many different community events, and will continue to be. We're scheduled to be at the Benton County Fair this summer, a couple of events, and the bikes, and yeah, in August. So most of what we do is education and community outreach. It's not seeing patients 9 to 5. And we are developing the program to see the patients in follow-up. We find that many, many people do not seek follow-up care after they are initially seen by us. And in providing that follow-up care, they do not have to tell a new provider what it is that's happened to them. They do not have to go through that story. The same nurse that did the initial exam will see them and follow up. And that's a public health issue, that we want to see these patients back to make sure the medications we've provided them have worked. So when somebody comes in, it's important for people to know, when somebody comes in, there is a fund that pays for their time with us. It pays for emergency contraception, and it also pays for sexually transmitted infection prevention. So cost should not be a barrier also. But all of the time that we spend, Sarah's Place is a community benefit. So we do run in the red. We will continue to run in the red. It's wonderful that Samaritan is willing to help us. Yes?
How would people make donations?
Through the foundation. We welcome any kind of donation, but yes, it's through the foundations of any of the hospitals. Also, the Samaritan Employee Caring Campaign, many people have donated through that also. So. Yes? No, we accept from doctor's offices, urgent cares, the EDs, and we have seen patients from some of the child abuse assessment and intervention centers from outside of our counties. So, The colleges also, send us patients, both LB, Western Oregon, OSU, and I think we've had one from Portland State. So we will see anybody that comes, no matter where the assault happened, no matter what the age. If it's appropriate to be seen at the ABC house, they are sent there. We communicate quite often, at least weekly, with the ABC house. So we really try to reach out and make our services accessible to everybody, no matter what age. So, okay, thank you.